The next question, the member for Scarborough-Guildwood.
Thank you, Speaker. Happy International Women's Day to all women. Today I wear green for hope. My question is to the Minister of Health. Minister, Scarborough has been the hardest hit community in Ontario when it comes to COVID-19 in the pandemic. Hospitals in Scarborough have had the highest COVID inpatient numbers, more than any other health unit in the province. For every 100 individuals infected, 5 end up in ICU in Scarborough. The Ontario COVID-19 Science Table reports that a vaccine strategy that prioritizes both age and neighbourhood would prevent an additional 3,767 cases, 702 hospital admissions, 145 ICU admissions, and 168 deaths from COVID-19, as compared to a strategy that prioritizes based on age alone. Equal share of vaccines to all hospitals sounds fair, but it is not when you consider the positivity rates in Scarborough and the infection rates and the ravages of this virus over the last 12 months. Minister, will you prioritize the distribution of vaccines to Scarborough hospitals and clinics today?
Minister of Health.
Well, thank you, Speaker, and thank you very much to the member for the question. This is a really important issue. We do have a vaccination plan, one plan that is being rolled out by the 34 public health unit regions across the province. The allocations are based on the population in the area, but it's also looking at things like at-risk neighbourhoods, at situations where there are a number of homeless shelters, for example. There are additional vaccines that are allocated based on that, because we know that there are situations where there are some at-risk neighbourhoods where they have exceptional rates of both COVID-19 infections, hospitalizations, and unfortunately deaths. We are taking both age and risk into account in both allocating vaccinations and setting up the clinics. As a matter of fact, I will be visiting a mass vaccination clinic this afternoon with the Premier.
Response? Any supplementary?
Thank you, Speaker, and I thank the Minister for that, and I would love to join you on that visit in Scarborough, because that is not what I am hearing from the health providers in Scarborough. We have not seen the number of allocations based on risk, and we know that Scarborough has been the highest hit community compared to anywhere else in terms of the infection rates as well as the hospitalization rates. So therefore, they do require more vials of vaccines. And I can appreciate that other hospitals and areas in the province have extra vials, so they've started to vaccinate those 80 and over in their communities. The Scarborough allocation has not even been enough to do the allocation of phase 1. So they need more vaccines for the size of the problem that they have, based on infection rates, based on positivity rates, based on death rates. We have the data, we have the science, we have the ethics to make this decision. Will you provide the vaccine so that Scarborough hospitals can do the vaccinations to those over 80 in the community this week?
Again, the Minister of Health.
We are taking all of those factors into consideration. Every public health unit region across Ontario, all 34 of them, receive vaccines based on population and based on risk, based on at-risk neighbourhoods, based on the number of shelters, homeless people that they have. All of that is being taken into consideration. Scarborough is no different than any other community. What I would say is that some areas with smaller populations are now able to do the inoculations of people over 80 years of age. In some parts of Toronto, that hasn't happened yet because of the number of essential workers that need to be inoculated, the number of people in long-term care homes, and so on. But I can tell you that over the next several weeks, Toronto's Pfizer allocations are going to be quadrupled, in addition to 17,000 doses of Moderna this week, to plans to increase future allocations to over 7,000 doses in future shipments. I would also point out that according to the COVID-19 Science Advisory Table, due to swift action by our government and in conjunction with our partners, our implementation of the vaccine rollout to the long-term.
Thank you. Thank you very much.